I want to tell you this for free. That is very hard for you to talk about nutrition in babies before discussing nutrition in pregnant women or those women who are preconception, basically women who are anticipating a pregnancy. It's very difficult. Why? Because everything that is going to happen in these babies is actually as accumulative behavior of the mother. And pregnant women are eating a lot of crappy foods. I've talked about this multiple times, and it's beginning to sink in people that people have to be cautious about what they are eating. We've realized a lot of pregnant women are eating a lot of crappy foods and it's becoming a serious problem. So I will tell you this, that breast milk that you're producing is actually as nutritious as the food that you're eating. If you're eating crappy foods, of course, what do you expect? Your nutrition will be messed up as a mother. If you're eating crappy foods, if you're just taking sugars, the chocolates, and you're claiming that you're craving all these things, you're going to mess up your system entirely. So yeah, good. So we'll talk about how pregnant women are supposed to behave, what they're supposed to eat, what they're supposed to avoid. But of course, we've been talking about these things over and over again because it's obviously and most often, of course, the same things that we eat when we want to lead a healthy life, what we've just been discussing in this channel. But this is the most important part, that every child gets their first layer of immune cells or their first layer of microorganisms through vaginal birth. So when you're giving birth through the normal delivery, the vaginal birth, that birth canal has microorganisms. And apparently the first normal flora, when I say normal flora, I mean the first microorganisms that inhabit the gut of the baby. Remember, these children are coming from a bubble and their world is basically zero microorganisms. In the placenta, they have a very healthy environment, zero microorganisms. But by the time they're getting to get out of the womb to come into this new world that is full of bacteria, their first layer of bacteria comes through the vaginal birth, the birth canal. And this birth canal is actually lined with very healthy bacteria for this baby. But remember, these microorganisms are going to the gut of the baby. So remember, the gut of the baby, do you remember in biology, in the small intestines where absorption happens, for you to have a larger surface area, we had things like, they used to call them finger-like projections that were called the villi and microvilli. Do you remember that? So these finger-like projections, what they do is they actually increase the surface area under which you absorb food. But most importantly, they are covered with layers of microorganisms. But when a child is born, they don't have this layer of microorganisms. They're just sterile. Their guts are sterile. So they don't have this layer of microorganisms. But when they start breastfeeding, when they get through the birth canal, that's where they get the microorganisms. But remember, these microorganisms, the ones that line this gut, actually, the major one is the lactobacillus acidophilus, okay? The one that is present in the probiotics and the prebiotics that you guys buy in the pharmacy. But that which is in the yogurt is very questionable because we have no idea if they actually add in that. So it's very unhealthy to give your child those probiotics thinking that they're going to fix their gut. It's a lie. It's not okay. So now, for you to have these microorganisms, of course, they have to come from somewhere because this baby was born with a sterile gut. So they have to come from somewhere. And when they come from somewhere, it means when they come and fix themselves in this microvilli. They help the baby in digesting the milk. They also help the baby in protection because they are now normal flora. When they get to the gut, they become normal flora. And what does normal flora mean? It means these are healthy bacteria that we inhabit in our guts. And they help us break down fiber. They help us break down some foods. And then they give us the B vitamins. So they are very important when it comes to gut and nutrition for this child. And remember, anything that's going through the mouth had to be broken down to a level that is easy to absorb through this microvilli, the surface of the small intestine, where most absorption takes place. So this child gets this bacteria and they come and they line these microvilli. And when they align that, they start helping them digest the meal, they help them absorb vitamins, they help them clean the gut, and also protects the child from other harmful microorganisms because these good bacteria, they compete with bad bacteria for food, for nutrients and space. And therefore they end up overwhelming the bad bacteria and they die. The bad bacteria die. So they are actually part of your immune system and part of your baby's immune system. Okay. Also remember, there is a direct relationship between the gut microorganisms and brain issues, this mental health issues. Most people who have been diagnosed with depression and all these mental health issues actually have a very messed up gut. Okay, so that's the reason why we say you have to fix your gut. So these are helping you in immunity, in digestion and absorption of food. But most importantly, when a mother gives birth through CS, and I talked about CS birth against or vis-a-vis the vaginal birth, the natural way of giving birth. What happens is, if a mother gives birth through the sterile and aseptic techniques, the CS, this procedure does not expose this child to the new bacteria or to this bacteria that will actually start the process of his or her immune system. So what does that tell you? They start a game at 1-0 down. Okay, so which means they will have to struggle to get that immunity as compared to children that are born through natural birth, and that is us just trying to make our children suffer. So where do we get this bacteria from? Where do these children get this bacteria from? Number one, of course, through the vaginal and the birth canal. So when you're giving birth naturally, what you're doing is you're actually exposing the child to those bacteria, and they get those bacteria, which get through their mouths and get to settle into the small intestines on the microvilli. That is the first layer. Okay? So giving birth through CS is not a problem unless it's an emergency. That's where I advocate for it. But if it's not an emergency, you're actually messing up these children. Number two, pregnant women are always on antibiotics because of infections. You're always taking amoxicillin, plus that antifungal that you insert in the vagina to treat the urinary tract infection. So your immunity, of course, goes down because now there's somebody growing in you. There's a baby growing in you, and possibly your immune system has to go down because you're like sharing, in quotes, the immune, even blood. So a lot of things are happening. Hormones are coming in, and there's a lot of changes that actually cause your immunity to go down. Now, when your immunity goes down, of course, you start getting infections. But remember this, the only thing that takes your immunity down is not because of the pregnancy, it's because of the foods that you're eating, because the same foods are the ones that are supposed to boost your immune system. So if you're eating crappy foods, the sugars, the seed oils, the wheat products all through, what do you expect? Your immune system will be low. When the immune system is low, you will have to be put on antibiotics for different conditions. And when you're taking those antibiotics, some of these antibiotics, like penicillins, examples are amoxicillin, which is the safest one in pregnancy, and even cefixime, they are broad spectrum. So they act upon a large variety of bacteria, including the good bacteria. So when they kill the good bacteria that line your villi, what do you expect? Digestion will go down, absorption will be hindered, and then your layer of immunity will be, the barrier that helps your immune system will be destroyed. And now you start getting infections. Now, when you use that antibiotic and it clears those good bacteria, the next thing that is coming up is, of course, you now have a messed up or a gut flora. So if you get to use multiple antibiotics during a pregnancy, your immunity is already down. Now that will be passed directly to the child, because you can imagine the amount of bacteria that will be in the vaginal canal. Very messed up. So this child will start a game at 1-0 already. Okay, so you're supposed to eat healthy foods when you're pregnant. In preparation, actually before you even get pregnant, in preparation for the pregnancy, so that you can carry a smooth and a very calm pregnancy, and then you also prepare for the aftermath after you've given birth. What next? Because you need to prepare for the baby to get now enough breast milk and they get the immunity that they deserve. But you eat a lot of biscuits, a lot of cakes, a lot of sugars, a lot of milk, and your gut is always compromised. So by the time you're giving birth, this child does not even have enough good bacteria to protect their guts. Okay, you're slightly better than somebody who gave birth through a cesarean section, but you're still off, very much off from somebody who has been eating healthy foods, and that's what I wanted to correct. Okay, so if you're a pregnant woman and you're using antibiotics all the time, start thinking twice. If you're using steroids, let's say you are asthmatic, you're using that inhaler. Let's say you have arthritis, you're using all these drugs for arthritis, the steroids, prednisolone, dexamethasone, hydrocortisone, beclomethasone. Those are drugs that actually affect the gut normal flora, and they will destroy your gut. So you'll have problems. Number three, if you're on painkillers all the time because of the back pains, because of the weight that is coming with the baby, and you're using the NSAIDs, the diclofenac, the ibuprofen, the aceclofenac, the meloxicam, even though these drugs are supposed to be used with a lot of cautions in pregnant women because they can affect the lungs of the baby, you're supposed to stay away from these painkillers totally, apart from paracetamol. and you're supposed to use that paracetamol only when necessary. You don't use it all the time. So when you use these painkillers all the time, they mess up the gut flora. And now that's another problem, because remember, we need that gut flora fixed so that you get to pass it to your baby. Okay? So you don't affect the immune system of this child. And nowadays, women are drinking alcohol. You're pregnant and you're drinking alcohol. You're saying actually wine is good for the gut and digestion. Now you're taking alcohol when you're pregnant. What do you expect? Alcohol destroys the gut flora. Alcohol is highly inflammatory to your gut. It destroys your gut and therefore low normal flora. Okay, so all these things are bringing issues. And on diet issues, I always tell you about the spices, because this is where most women also fall. The diets, the spices that are processed, that have MSG, monosodium glutamate, these are spices that actually destroy the normal flora also. So those spices that you take, those cubes that you buy to just spice up your sukuma wiki to taste like meat, you know them. Don't use those things when you're pregnant. You'd rather prefer using things like garlic, organic garlic and ginger. Garlic is a natural antibiotic that can actually help you fight some infections in pregnancy. But the best thing about it is you'll still preserve the gut microbiota. So you need it. And you need it for the development of the brain of the baby, because there is a direct relationship between the gut and the brain. So now, this is where the story of vaccination starts. So when you have a messed up gut as a pregnant woman, you are absorbing very minimal nutrients. So already you are malnourished. That is just going to be passed to your baby. But most importantly, for you to vaccinate a baby, their gut microbiota has to be messed up totally. Like, the reason why we vaccinate these people or these children is because we want to boost their immunity, right? We want to give them a super immunity against diseases. But if your child has a proper gut, so you've been eating healthy, and then you gave birth to healthy babies, you gave them breast milk for 6 months straight, and now you wean them off to healthy foods that we just talk about in a few, this baby does not need those vaccinations. Remember again, vaccines, if you read the history of vaccines, you'll get so disappointed, because most of these vaccines are actually businesses. That's why you still take that BCG vaccine, but still contract tuberculosis. Have you ever asked yourself, why is it that you take a BCG vaccine when you're a baby, and then later on you contract TB? Does it mean this vaccine goes down in the system and now you need a booster? When you talk about the boosters, all of you can relate. When I'm talking about boosters, I want you to always have that disease that just happened recently as a focal point. So vaccines are only coming in because, of course, the business understood, the market understood that most of you are eating very unhealthy foods. There is no organic foods, there is no whole foods, your foods are nutrient-less. So therefore, of course, the guts of the babies will be messed up, because they're actually in breast milk comes some of these gut microorganisms. Thank you so much, Enrique. So the gut of the baby harbors microorganisms that are coming in through, one, the vaginal canal bacteria, and number two, the breast milk. And also on the nipple, there are microorganisms that inhabit the nipple. Those microorganisms are actually taken in. The baby suckles them in and they start protecting the gut of this baby. But, of course, those cautious moms who will always sanitize the nipples and all that. And of course, those modern women who don't want to breastfeed, you know them, they want to stay, naita sasita, their breasts need to stay in a certain shape to please the men. Now, remember these ladies, those breasts and that breast milk is for the baby. After you've gotten pregnant, those breasts start to gorge with milk because they are preparing for the upcoming baby. But you denying a baby milk and putting your babies on milk formulas just because you want your breasts not to sag, it is one of the most disrespectful things to nature. You're denying these babies a lot of microorganisms, a lot of nutrients, and now you're giving them synthetic products, the milk formulas, that are zero in nutrients, that are a waste of time, that inflame the child's gut. And no wonder we are having all these asthma cases, we are having all these eczema cases, we are having all these dermatological issues, we are having all these issues with the brain and mental health conditions in babies, in young adults. Now, ladies, keep this in mind, that your baby is not a small adult. I'll repeat that. Babies are not small adults. When I say that, I mean it. Babies are not small adults. Imagine the stomach of a baby is like their fist. And now you're there, you want to feed this baby all the time. Please be very cautious. Always look at your baby's behavior, because I know most of you are Google mothers. So you're always on Google searching for this, searching for that. You don't want to look attentively at your baby and see what is happening to this baby. So you're always trying to look for things here and there to just make sure that you can raise this baby in the right way. But you see, that's where we messed up, because boys, when they were growing up, most of the times they were raised by uncles or by their fathers. So they were taught how to grow into being men by their fathers and uncles, until industrialization came in and fathers had to move to the urban setups. And now boys were left with mothers. That's the reason why we're having all these emotional boys. Number two, girls were designed to be taught some of these things, breastfeeding, how to take care of a man and a home, by their mothers and their aunties. But nowadays, even your auntie is envying your life, so she has no business with you. She's just looking for one opportunity to just clear you out. She's actually looking for one chance that you will mess, so that she can pour her heart to you and tell you how boring you are. So we don't have that family bonds, and you can even see it in families nowadays. All of the people are on phones in the homes. So that family unit is not there anymore. So even teaching these daughters how to breastfeed has become a serious problem. So ladies have to get lessons for breastfeeding from the internet. And now the internet, everybody is saying everything. When your daughter goes to the internet to just search for breastfeeding techniques, this woman is saying this, and she's saying she's a nurse. There's another nutritionist who's saying this. There's another doctor somewhere saying this. And now you're like, now I just started breastfeeding this way. Now this one is saying, no, when you're breastfeeding this way, your child will choke. You are now getting to another one. Another one is telling you, don't eat this. And you hear Dr. Lewis is telling you, don't eat fruits and honey and all that. You're now wondering, which one should I follow? And it gets so confusing. So you decide, whatever comes, let it just go. And now when you search those things on the internet, every platform that you're on brings you the same things. Now you land on a nutritional supplement from that company that is actually actively marketing, because the algorithms of this internet, when you're trying to search one thing, you will get the same thing coming over and over. You know that. So you now get that woman there carrying a doll and marketing that supplement, and you get intrigued and you go buy that supplement. That's a problem, because you're going to mess the gut of the baby. Babies are supposed to feed on only breast milk for 6 months straight. And there is a reason why they get those 4 teeth that are called the milk teeth. Those milk teeth are there to show you something, because nature is always talking to you. Those milk teeth are there to tell you that this baby can only feed on milk. These teeth are not there to help your baby digest or break anything. They are there to tell you that this baby is supposed to feed only on breast milk. But what do you do? What do hospitals advise you to do? Hospitals advise you to give this baby cereals and milk, right? And then which milk are you using? Pasteurized milk. Zero nutritional benefit, zero microorganisms, very useless, and has preservatives. And now your baby starts getting acne from nowhere. Your baby starts getting eczema. And guess what is the next thing? You'll go to the same people, but in a different setup. You'll go to the hospital, and an agent of the big pharma will write you antibiotics for the baby. Those antibiotics will clear the gut of the baby, the microorganisms that are actually supposed to boost his immunity or her immunity. And now you're taking antibiotics. You're actually telling the doctor, give me the original one. Because do you think original ones are going to help your baby to heal? Antibiotics, I told you, they're not here to heal you. They're here to reduce the bacterial load to a certain level that the immunity takes over. So now you're given antibiotics, they will end up messing the gut of the baby, because you'll not take a probiotic. You're given antihistamines to just solve the symptom. And then you are given an analgesic, maybe paracetamol syrup. Now you come back home. After 7 days, you're back to the hospital just because you have a very healthy insurance. And you want your child to take these drugs over and over and over. I see women all the time. Women in the hospitals every weekend just because they have the healthiest insurance. You want to shop, you're using that insurance as a shopping voucher. This weekend is these types of medication, these antibiotics. Next weekend is this type of antibiotics. And all these antibiotics are ending up in the gut of your baby. What do you expect? Very weak immunity, very messed up gut, therefore mental health issues. And now the next thing is your child is now diagnosed with high ADHD. And now you have to go for drugs again for ADHD. Depression, drugs for depression. Look at very young girls and young boys getting depression. Where from? Fix the gut of these babies.